Hey fitness and rehab pros, we wanted to share with you a really novel way that we have learned to get after the glutes a little bit differently, the posterior hip and the glutes, using the reactive environment created by the Core-Tex. Not only does it get after the posterior hip, but it really exposes the knee joint to some very beneficial frontal and transverse stresses that it adapts to over time as a result of the rotational aspect of the Core-Tex. You can see our client right here. She's going to be really driving the platform with her foot, but also we want to take note of the preposition that she's in, where we have her fully loaded on that front leg because we've elevated the back foot with a little step, and this way we know for sure she's got all her weight on that front leg. Viewing from the same side as the active leg, we also wanted to make sure you took note of how important that angle is of her torso being forward, so she's flexed at the hip, which preloads the glute in the sagittal plane before we do anything with the motion in the frontal plane. The other thing really worth taking note of is the fact that we have the opposite hand, so in this case the right hand is reaching across the body and about mid-level of the vertical bar on the handrail, and the other arm is across the horizontal bar. She's supporting herself and anchoring herself there with that bar, and from there, again, she's in that ideal position to really generate that motion rotationally and getting the whole hip involved as she does that. There's so much in the news today about these elite athletes and these non-contact injuries, especially these injuries around the knee, and it's clear through the science that if we're not exposing to these athletes and their training regimen outside of the normal zone that they're working in, if we don't expose them to more, then the tissue and the joints and the timing of that stabilization is really never going to be available to them. So what we've done is taken one of these unique little tools that the SPARC motion has available and superimposed it over our client's knee here, and we're going to slow down the speed just a little bit and have you watch the motion of that knee that continues to follow a little bit farther, a little bit faster than the hip, and then of course the foot is doing even more, going a little bit further and a little bit faster with that. You can again clearly see where her arms are anchored to really facilitate what we're looking to have happen here with this motion. Taking a look at it in real time here, you can see what's required of her in that acceleration and deceleration, and which is really loading up that glute, and especially the aspect of the glute that's responsible for a lot of this transverse and frontal plane motion. Finally, we wanted to show you the back view, and this view probably shows the overall reactive variability that occurs throughout the entire body better than any of the other views as she goes through the motion. As she drives that platform, you can see the whole pelvis kind of moving. We're even getting some activity in the thoracic spine because she's anchored with her upper body with those arms going in opposite directions. And the rear foot, again, that's on the step that's elevated, is doing a whole lot of stabilization there to provide that anchor point from the bottom up with what's going on there. So this can be an exercise that, of course, the variables can be manipulated in terms of the speed at which they're turning, the range of motion in which they're rotating the platform, and you could even potentially raise the back leg higher. We've done it on the power plate at times, which even puts more of a forward trajectory, the center of gravity over that front leg, or the back leg could be on the floor, which unloads the front leg a little bit and provides those different options in terms of how you want to progress this with your client, patient, or athlete. Thanks for listening.